My name is Dr. Brooke Pellegrino. I am a clinical health psychologist at Hartford Healthcare Headache Center. I specialize in treating migraine and other headache disorders, as well as sleep disturbance, depression, anxiety are probably the three most common things that we see in our headache clinic. And so I work to treat those as well. So I'll tell you a little bit about my background. I went to graduate school at the University of Mississippi, and that's where I got my PhD in clinical psychology. And then I did a year of internship at the University of Florida in health psychology. And then I did a 1-year postdoctoral fellowship at Geisinger Medical Center in Pennsylvania, also specializing in health psychology. So I just want to preface this Facebook Live by saying I think this is the American Migraine Foundation's first time hosting an event of this kind. And so please bear with us as we work through this, especially with me. I'm going to be trying to look at your comments and your questions on the website and respond hopefully accordingly. So we'll start out with a couple of questions that people have asked ahead of time, and then we'll move to take live questions via the Facebook group page. Okay, so I'm not sure how to look and see if new people are joining, so I might just take a second every now and then to kind of reintroduce myself. So if you're just joining us, my name is Dr. Brooke Pellegrino. I'll be answering your questions tonight about migraine and sleep. So actually, I guess let's go ahead and get started with our first question. So a question that someone sent ahead of time said, is it common for migraine medication to cause nightmares? That's really a great question, and I don't know if it's common, but it definitely happens. And there are definitely some medications that tend to have nightmares as a side effect more than others. So your beta blockers like propranolol and metoprolol will tend to do it more than others, as well as some of your antidepressants that are sometimes prescribed for like the prevention of migraine. Those can sometimes have the side effect of nightmares. And the most common ones there are Paxil, Lexapro, Effexor, Zymbalta, things of those kind. So that's a great question, and basically the answer to that is yes. Sometimes the medications you take for migraine can cause nightmares or have nightmares as a side effect. Really, every person is different though, and so you're going to react differently to the medication. So I would say it really just depends on the person, if that's going to happen for you or not. And sometimes it won't necessarily be nightmares, but maybe just more vivid dreams. So I think that's important to keep in mind too. Okay, so hopefully that was helpful to the person that asked that question. And so we had another question from Ashley Logan, who actually asked, is there a link between migraine and insomnia? And that's a question I get a lot. And I think that the answer to that is definitely yes. That we really do see a link between migraine and insomnia. Insomnia is probably one of the most comorbid or co-occurring sleep disorders with migraine. So we see that a lot in our headache clinic and in headache clinics across the nation. The good news about that is we really do have some great treatments for insomnia and good behavioral treatments, non-medication approaches. And what we find in research that we've done, myself and other colleagues of mine, is that once you treat the insomnia, that the migraine does often significantly get better. So that's great news. That's definitely a co-occurring condition that we want to pay attention to when our patients are coming into clinic for sure. So great question, and the answer to that is definitely yes. So it looks like I'm going to mix it up a little bit and try to answer some questions too as they come in. And it looks like, so somebody asked maybe as a follow-up to the question I answered about the medication is, what do you recommend to people if they have a bad reaction to a medication, and should they find an alternative? I would definitely say it depends on how distressing that is for you. For some people to say they have vivid dreams, I would say, even though they notice it, it might not be that distressing. And so if the medication's working really well otherwise, that might not be something that you want to change. However, if you give the medication a try for a while, it doesn't seem to be helping that much, and you're having the side effect of nightmares, and I would say it definitely at that point, we could, you would definitely want to talk to your medical provider about perhaps switching that medication. So that's a great question. I'll try to answer maybe the two more that came in earlier, and then I guess we'll open it up, and hopefully people, please keep sending your live questions in via the Facebook page, and I'll try to get those answered for you before we end tonight at 7:30. So another question that came in earlier was about sleep apnea. So does sleep apnea contribute to migraine? And the answer is, again, just like insomnia, yes, is that it definitely can. So sleep apnea is probably the second most common sleep disorder in people with migraine, and I would say it's definitely a very important co-occurring condition to pay attention to. Oftentimes, the biggest signs of sleep apnea are snoring, being overweight. If you have a spouse that tells you that you wake up in the night because you stop breathing, obviously that's a big sign. And really the only way to get that properly diagnosed is through a sleep study, either done at home or in the clinic. And one of the best treatments for sleep apnea is a positive airway pressure machine, so like a CPAP or a BiPAP or something like that. And a lot of people, what they'll notice, especially if they're like waking with headaches in the morning that could be caused by, sleep-related breathing disorder, is that once the sleep apnea is treated with a PAP machine, is that the headache will improve. So yes, I would say, if sleep apnea is suspected, I know in my practice especially, that's one of the first things I ask about, and one of the first things I refer for is a sleep study to make sure we can rule that out as an option or get it treated if it's present. So that's a great question. So one I just got that came through, Rebecca Simpson asked, what are some good anti-anxiety and antidepressant medications that don't exacerbate migraines? So that's actually a really good question too. So I think, again, everybody's different. Everybody's going to react differently to medications, as most of you probably know and have experienced. But I would say, in general, we don't see headache as a very common side effect for anti-anxiety and antidepressants. So I think most of them are going to be pretty safe, and actually most of your antidepressants, or some of your antidepressants, shall I say, can actually be used as a migraine preventative. So we have some pretty good research on that, and I would say to get a list of the specific medications, it's a good idea to search there's a study, that kind of a culmination that we did a while back, myself and some colleagues of mine, that kind of showed what antidepressants were the most effective for headache and at what doses, because I would say some of the medications that we prescribe for depression versus headache, sometimes they have to be at different doses, so they are not going to have, an equal effect on both of those things. But that's a great question, and so I would say, definitely don't be scared of an antidepressant or anti-anxiety medication because you think it might cause headaches. I would say, wait to see if that's the case for you, and if it is, obviously, then, you can try something different. But I don't think that's too common from what I hear anyway. So, All right, so I'm seeing we had a couple people just join, so I'm just going to introduce myself briefly again. So my name is Dr. Brooke Pellegrino, clinical health psychologist at Hartford Healthcare Headache Center, and I'm talking about the relationship between sleep and migraine tonight. So I got a question from Teresa Texley, and she wants to know, she said she's been diagnosed with cluster migraines. Do I have any info I could share on these? And she currently takes Topamax. So Teresa, I don't know if you maybe have a question. I don't know if that's related to your sleep at all. That's okay. I'll try to answer the best I can. So cluster headaches or cluster migraines are more rare than your regular migraines. They can be very debilitating, as I'm sure you know if you have them. As far as treatment goes, I mean, usually kind of the most recommended treatments are oxygen, sumatriptan. A lot of people find oxygen very effective, actually. So if you have a headache provider, I would say definitely reach out to them. You can even do a little bit of research, but like I said, oxygen is prescribed a lot, or sumatriptan is also prescribed a lot, or Imitrex as an abortive. And oxygen is meant to be more of a preventative as well as an abortive. So, but definitely I would say talk to your provider about that, what treatment might be best for you. But the Topamax you're on right now might be a good start, and hopefully it helps. All right, so another question we got earlier, since I don't see any live question coming in, is does anyone else happen to cycle through bouts of insomnia after recovering from a migraine? That's actually a really interesting question. I've actually never heard that before, or never heard someone ask that, but I definitely could see how that would happen. And the answer to that is I think it depends on how you're sleeping. So if you tend to sleep when you have a migraine, like if you tend to nap, then I would say obviously that's definitely going to have an influence on your next night's sleep and even the next night. And so if that's the case, then you might notice your sleep is a little more disturbed even after your headache is relieved, maybe because you changed the way you were sleeping when you had a headache, or because your sleep was negatively affected because of the headache. So I can definitely see how that would happen. As far as a direct relationship, though, just like it does the headache, cause insomnia after it's resolved, I would say probably not, but I think headache does lead to a lot of sleep disturbance. Either, you're trying to sleep to treat the headache, or perhaps your headache is waking you up during the night, which can lead to sleep disturbance. So I think that's probably how that tends to affect insomnia even after your migraine is relieved and recovered. So yeah, that's a great question. Do we have any other questions that people want to ask live? I think we have just a tiny bit of delay. So if you recently did ask a question, I'm sure it'll come through soon. But again, so if you just joined, I'm specifically taking questions tonight about headache or migraine and as it relates to sleep disturbance. So if you have any questions, anything that's come up for you, I'd definitely be glad to answer that. Again, I'm Dr. Brooke Pellegrino, clinical health psychologist at Hartford Healthcare Headache Center in Connecticut. And I currently specialize in treating headache as well as depression, anxiety, sleep disturbance. Okay, great. I just saw another question came in. So Abigail Chua, who is actually a colleague of mine at Hartford Healthcare Headache Center. She's a neurologist, so thank you for joining us, Dr. Chua. So I'm sure she's asking this on the behalf of her patients. She said, "What are some good resources for patients who are interested in learning some relaxation techniques for insomnia?" So that's a great question. So first of all, I'll start out just a little bit explaining how relaxation can help with insomnia. So a lot of people will say when they're finding it hard to fall asleep at night or find it hard to fall back to sleep after awakening, it's because their mind is just going. Either that or they feel like they're physically awake. And so relaxation techniques in those cases are definitely can be helpful. And so I would say there are a lot of different kinds of relaxation techniques out there. There's something called progressive muscle relaxation, which has you tense each part of your body, each muscle, for 5 seconds and relax it. There's something called autogenic relaxation, which is kind of similar, except you don't do the tensing part, you just do the releasing part. And then there's something that I think is people find pretty relaxing before sleep. It's called guided imagery. And so there are a couple of resources out there for patients. I know that I've tried to develop my headache center's website in order to provide these resources for patients. So if you go to hhcheadachecenter.org, it'll tell you about CBT and about relaxation, and we actually have some good there's some audio recordings on there for progressive muscle relaxation, and I am adding more in the future. And I see Sharon Murray actually just shared another one. So a colleague of mine who's also a psychologist in New York, Dr. Dawn Buse, she actually has another website too that has some relaxation techniques on there. And I would say you can find these in a lot of places. Pretty much anything to your liking, with music in the background or no music. And I would say you can just usually if you just do a search on YouTube or something like that, you can find progressive muscle relaxation, autogenic relaxation, and guided imagery. And again, you can go on Dr. Buse's website, or you can go on our website at Hartford Healthcare Headache Center, and there's some audio recordings there for you too. And somebody just posted a link. Thank you so much. I think that's our moderator. So if you're following this thread, our moderator just posted a link to the Hartford Healthcare Headache Center, so you can get on there and listen to the progressive muscle relaxation audio recording. And again, I'm hoping to add more onto that in the future. So we're kind of building up our website now, but there are definitely resources out there. So that's a great question, Dr. Chua, and I would say that there are some resources for your patients. Do we have any other live questions that people would like to ask? So I saw there was a couple people who just joined. So I'm Dr. Brooke Pellegrino, clinical health psychologist at Hartford Healthcare Headache Center, and tonight I'm answering questions about sleep disturbance and migraine. And please send in your questions if you have any. Okay, so just got a question from Carol Vassar, and she asks, are there sleep habits I can integrate into my life that would help prevent migraines? Carol, that is a great question, and I would say there are definitely some sleep habits that you could integrate that would help with migraines. And that's kind of the idea of getting good sleep anyway, is that it's really about prevention. So if you're sleeping well, then you'll usually notice that you're not having as many migraines, especially if you suffer from insomnia. So I would say some really good habits to start with are things like avoiding anything too stimulating before bedtime, either physically or emotionally, not engaging in other behaviors in bed other than sleep. So, removing your phone, don't look at your phone in bed, don't read in bed, don't watch TV in bed, really using the bed as like a sacred place just for sleep. That's a great way to start. Another couple easy things you can do. Things that you would think, like not drinking too many liquids before bed, because that can, make you have to get up to use the restroom. So there's some things like that you can do. I would say another thing that maybe is not as intuitive as those things are if you're not sleeping. So if you're, either taking a long time to fall asleep, or you're waking up in the middle of the night and then it's taking you a really long time to go back to sleep, I would say don't lay in bed just worrying about not sleeping or staring at the ceiling. Go ahead and get out of the bed. So you really should get out of the bed, go do something low key until you feel sleepy again, and then you can come back to bed when you feel like you can sleep. I would say, like I said, that might seem pretty counterintuitive. People think, oh, well, if I just stay in bed, then sleep will come. Unfortunately, usually sleep just doesn't work like that. And so if you're really not sleeping, you should go ahead and get out of the bed so that you're not spending too much time awake in the bed. I would say those are two of the biggest things you can do. Another thing is keep a regular bedtime, keep a regular wake-up time. Your body really likes to operate on a schedule. You probably heard of your body's circadian rhythm, which is your body's sleep schedule. And that's really true. It does like to keep a schedule. So if you can go to bed at a consistent time every night and wake up at a consistent time every morning, even on the weekends, which I know people don't like to hear, but really as much as you could adhere to that, the better, and the better your sleep will be. So those are just a couple of things that you can do to really improve your sleep. Another thing, again, which I know migraine sufferers usually don't like to hear. Myself, I'm a migraine sufferer as well, and I wouldn't like it if someone told me this too. But naps are pretty bad for your nighttime sleep. Even though a lot of times, people, when they have migraine, as in response to that, they oftentimes want a nap because it will help the headache go away. And that is true, and I'm not saying that you shouldn't do that, especially if it helps significantly with the headache. I'm just saying, be aware that if you do nap, it will likely affect your nighttime sleep. So that's just something to be aware of. But that's a great question, Carol. Thank you for asking that. If you go to see a professional to get treated for your sleep, those are kind of the things that your doctor or physician will tell you about. Okay, so it looks like we got another question from Henrique Rodriguez, and they want to know, is there an amount of hours which could be better, or is it individual? That is also a great question. Thank you for asking that. So there's kind of this myth out there that everyone needs 8 hours. And I would say that is kind of the average for most adults. However, it really does depend on the person. Some people tend to do well on about 6 or 7 hours, whereas some adults need more, like 9. It really does depend on the person. And I would say, though, when we start looking at extremes of that range, so I would say there are probably few adults that can operate well on 5, and probably few adults who need up to 10. But it really does depend on the person. But I would say if you go get, if you're looking for treatment for your sleep, something called cognitive behavioral therapy for insomnia is the best treatment you can get for that. And your physician or your sleep professional will actually work with you. You'll complete sleep diaries in order to tell what's the optimal amount of treatment or of sleep that you need. So that's a great question. I will try to take, since we got started a little late, sorry about that again, I was having some technical difficulties, but I'll try to take one more question maybe before we wrap up, if anybody has a question about migraine and sleep. Okay, so the last question I'll take comes in from Terry. And Terry wants to know, she said, I may have missed the question and answer, but does obstructive sleep apnea have an impact on migraines? She said, I have a lazy, soft palate and need an oral appliance to hold my jaw forward to open my airway. When I get a migraine, I always wake up with it, or could it be triggered by TMJ? Okay, that's a great question. So Terry, I did answer earlier about sleep apnea and migraines, and basically, yes, there's a big relationship there. And usually when the sleep apnea is treated adequately, then the headaches will usually significantly reduce in frequency and intensity. You ask an interesting question, though, in addition to your question about the TMJ. So I think that happens a lot. So people who have TMJ, or even people who grind their teeth or clench their jaw, happens sometimes with anxiety, as well as people who have problems with sleep. And I would say that any of those, if you treat those, it can definitely help with headache. So if you're having your TMJ treated, like you said, with an oral appliance, then usually yes, if it's treated adequately and if it's helping, then that can also help improve your migraines. Even with sleep apnea, if it's mild, they're making oral appliances now that actually help prop your mouth open in an adequate way to free up your airway and let you breathe a little better. So yeah, there are a lot of things out there now, even just kind of over-the-counter things, or that you can get from your dentist to help with some of these things. But yeah, if you're having TMJ pain, or if you're having pain from grinding or clenching, that can definitely exacerbate migraine, and getting that treated can definitely help with the migraine as well. So great questions, everyone. I've really enjoyed doing this Facebook Live event for Move Against Migraine, and thank you so much to our moderators who invited me to do this. And I will let them be in touch with you guys about when the next one will be, and what the next topic will be. But again, thank you so much for letting me do this, and I really hope I was able to answer people's questions about migraine and sleep.